Hi, my name is Andrea Klein-Tilford. I am a pediatric nurse practitioner, the immediate past president of the National Association of Pediatric Nurse Practitioners, and nurse practitioner director at the University of Michigan Health System. Welcome to this micro session, RSV and a risk for severe disease. Objectives for this session include discussing the background of RSV, risk factors for severe disease, and prevention of severe RSV illness. Respiratory syncytial virus, or RSV, is incredibly common. Not only is it common, it's incredibly contagious. Infection can occur through exposure to an infected droplet through a sneeze or a cough. Self-inoculation can happen after a handshake or touching a surface that's infected with the virus. RSV is very hardy and it can live on surfaces for hours. Nearly all children are infected with RSV by the time they are 2 years of age, and reinfection can occur throughout the lifespan. Typically, RSV results in a very mild illness similar to a cold with mild congestion and a cough and runny nose. However, in some children, RSV can result in serious illness and sometimes death. RSV will result in hospitalization for some children, and typically this is when the infection has spread to the lower airways, resulting in bronchiolitis or pneumonia. In fact, 1 to 3% of children with RSV will require hospitalization, and nearly 80,000 children under 5 years of age are hospitalized with RSV each year. There are several risk factors for developing severe RSV disease, and when this happens, there's an increased risk for hospitalization. Risk factors for severe disease include prematurity, age less than 6 months at the time that the infection starts, chronic lung disease, congenital heart disease, particularly if it's hemodynamically significant or includes pulmonary hypertension. Immunodeficiency also increase the risk for severe disease, as well as a neuromuscular disorder, which can impair the ability for the infant to cough and clear secretions. In addition to the well-described risk factors for severe disease, there are some additional risk factors with more limited correlation to severe disease, yet are still important for us to discuss. So these include low birth weight infants, maternal smoking during pregnancy, exposure to secondhand smoke, particularly if that's in the home setting, a family history of atopy, lack of breastfeeding, and household crowding, which then increase the risk for coming in contact with someone with RSV disease. There is an additional special population worthy of discussion. That is the American Indian Alaska Natives. This population has a 3 to 5-fold higher risk for hospitalization associated with RSV illness, similar to that of medically high-risk children. Household crowding and lack of plumbing are partially responsible for this increase in severe disease. Without an available specific treatment for RSV, prevention is incredibly important. For carefully selected high-risk children, a humanized monoclonal immunoglobulin is available. That is palivizumab. Palivizumab is administered at a dose of 15 milligrams per kilogram monthly during the RSV season. It is important to note that palivizumab is not an effective treatment of RSV disease, only a preventative strategy. So prevention really focuses on limiting exposure in contagious settings, hand washing, and limiting exposure to secondhand smoke. Looking into the future, there are currently late-stage RSV vaccine trials showing significant promise. This is very exciting for the advancement of pediatric healthcare. Thanks for joining.